Thank you for joining us. U.S. health officials say they're sending a plane to bring home 19 Americans who were on board the Dutch cruise ship at the center of the Hantavirus outbreak. The State Department says it's working with the CDC and Health and Human Services Department in coordination with Spanish officials. The evacuees will then be taken to the University of Nebraska Medical Center in Omaha to undergo observation. The center has a special biocontainment unit and was previously used for patients recovering from Ebola and the coronavirus. Earlier, officials at the university spoke about their plans for passengers once they arrive.
The quarantine unit enjoys an outstanding facility that's designed to limit the spread of the pathogen that we're monitoring for. All of these passengers will be monitored for symptoms. They're all well at this time and will be coming to us for monitoring. We have protocols in the quarantine unit that provide for safe care of these persons.
Health officials in 6 U.S. states and 11 other countries are monitoring people who were either on the ship and disembarked before the hantavirus cases were confirmed or were exposed during air travel. CBS News foreign correspondent Ramy Inocencio reports from Spain and the Canary Islands, where the cruise is expected to arrive as early as Sunday.
Protesters on the largest of Spain's Canary Islands are raising concerns about the upcoming arrival of the MV Hondius, the ship at the center of the hantavirus outbreak.
For me, not good.
I don't like the idea because in the hospitals we don't have too much beds.
These demonstrations come as global health officials work to track down passengers who departed the vessel before guests were put on lockdown.
This is a dangerous virus, but only to the person who is really infected.
More than 30 passengers from at least 12 countries, including the U.S., left the ship without contact tracing during one of its first port stops.
A lot of great people are studying it. It should be fine. We hope.
On Friday, health officials in New Jersey reported 2 residents were potentially exposed to one of the infected guests during air travel abroad, but are not reporting symptoms. Spanish officials say that cruise ship will remain offshore and not dock directly on this island as passengers undergo health checks. The U.S. has sent a plane with CDC staff to repatriate the Americans who will be placed in quarantine in Nebraska.
The individuals that we are currently planning on receiving have not been diagnosed with hantavirus. They are asymptomatic. They have been potentially exposed but not known to be infected with hantavirus.
According to the World Health Organization, 5 of 8 people sickened on the ship were confirmed to be infected with the Andes strain of the virus, which can be transmitted between humans, though rarely. Ramy Inocencio, CBS News, Tenerife, Spain.
For more, let's turn to somebody who we often turn to in situations like this, CBS News medical correspondent Dr. Céline Gounder. She is also the editor-at-large for public health at KFF Health News. So, Doctor, what happens once the people who are still on the ship are back in the U.S.? How long will they have to quarantine in Nebraska?
Well, we don't know for sure yet. So the WHO, their guidance has been to quarantine for the 6-week incubation period. But depending on which study you look at, because there have not been that many cases of hantavirus that we have been able to study over the last few decades, these are estimates. And so based on those studies, it could be as long perhaps as 8 weeks. I think that in the U.S., they are trying to hedge right now and see whether it's as long as 8 weeks that they will need to quarantine.
What are we seeing in terms of an American response?
Well, behind the scenes, some things are moving, but publicly, Americans aren't really hearing much. No one from HHS or the CDC has briefed the public. A health alert was not sent to clinicians until after 5 p.m. Eastern time today. I received that. A CDC source told me that the response team was only authorized to begin work late on Wednesday. And the holdup appears to have been getting a waiver from HHS to cooperate with the WHO. The same WHO, the current administration left. All CDC communications now have to go through heavy filters at HHS, which is part of the reason the public isn't hearing anything. And there are no pre-prepared quarantine protocols for hantavirus. They're writing them as we speak. So those 7 Americans who are already at home, monitoring is being handled state by state while the CDC finalizes their interim guidelines. But is someone checking on those folks at home, or is it the honor system? What happens if they get sick? Is there a hospital that has a cardiac lung bypass machine if they get sicker? We don't have answers to some of these really basic questions. We have no confirmed CDC director, no Surgeon General, no one standing up daily to tell the public what's being done. Taking a break from infectious diseases is not a plan. We hope is not a plan. Right now, what we have are concepts of a plan.
Is this anything like COVID?
This is not COVID. This is not airborne. This is not nearly as infectious. Most of the cases we've seen of person-to-person transmission of hantavirus actually involved sexual partners. Not to say that this is sexually transmitted, but it's that level of intimate contact, sleeping together, kissing, and so on. That's where we've seen transmission. The biggest outbreak of hantavirus in the past in Argentina, of people who were exposed, sexual partners who were exposed to somebody with hantavirus, 18% got infected. But among other household contacts, it was only 1%. So even household contacts were at very low risk.
Okay, Dr. Céline Gounder, thank you so much.